Hi, I'm Chris Bretherton. I'm a trauma orthopedic registrar from Oxford. Thanks for signing up to attend the WACS workshop on December 13th. This is a 10-minute presentation, and it's just going to give an overview of what to expect at the workshop and what you might need to do to prepare. So the background to ankle fractures is that, as you know, they're very common. There's 180 every day in the UK, and around 40% are treated with surgery, which equals about 20,000 operations in the NHS every year. In terms of weight bearing, the WACS trial is going to determine when patients should start to walk after their surgery, but that leaves the question of how, because even when people are told to walk, often they don't because they're wary and fearful of pain, falls and re-injury, and that delay can lead to problems such as anxiety, blood clots, stiffness, poor recovery, as well as increased dependency on social care and a delayed return to work and hobbies. And so the purpose of this workshop is to produce an evidence-based rehabilitation package for patients recovering from ankle fracture surgery. So I'm just going to go over and explain the different phases of the research and what's been done so far. So the first part is about determining if certain people are at risk of a slow recovery after surgery. And that's done by using information and questionnaires from patients in the WACS trial to see if certain people recover more slowly, be it people of a certain age or occupation, or those that experience pain in a certain way. The second was to investigate patients' experience of pain and try to identify helps and hindrances to weight bearing and recovery. And that was through interviews with patients and healthcare professionals. And a lot of the content, quotes and ideas that you'll see in the worksheet have come directly from those interviews. Thirdly, I've searched the existing literature to see what techniques have been used previously to help people recover from ankle fractures. And it turns out education and training are the most common techniques that have been used. And that's why there's a section in the workshop about that. Lastly, we're going to bring it all together and create a rehabilitation package to help people get back to walking, hobbies and work sooner. And that's through a workshop on December 13th. And then there will be another one after that with just healthcare professionals to refine the methods that we come up with in the first workshop. This is a slide about the WACS trial progress. The line below here shows how many we hope to recruit, and the line up here is what we actually did recruit. So actually over 100 more than we were hoping for, and that really is going to give us a really confident answer as to what the question, or rather what the answer to the weight bearing question is going to be. And this is a map to show you all the sort of different hospitals that participated in the WACS trial. And again, thank you for all of you that took part and have helped and are going to make this a good answer. So this gives an overview of the workshop. You'll be split into small breakout rooms and you'll be discussing different aspects of ankle fracture care. Firstly, education and training, and then later about improving access, and then lastly about monitoring progress. And then after that, we'll come back at the end and we'll have a summary and we'll vote on some of the most important aspects that you've decided upon. So overall, the aim is to design an intervention that reduces face-to-face follow-up and gives you access to credible resources and support from home. In document C of the pack that I've sent you, there's an A4 sheet with a table covering each aspect that we'll be discussing. And we've created that by compiling findings from the 40 interviews with patients, surgeons and other healthcare professionals. And we've come up with suggestions to help with common problems. And so here's an example. So in column 1, we give quotes from patients and about things that they've struggled with during recovery. And so someone has said that they didn't know how to weight bear or use crutches safely. And so in column 2, we've made a suggestion for what this new rehabilitation package could include. So to give them tips on doing that and tell them exactly what non-partial and full weight bearing means and show them how to do it. And so in column 3, there are suggestions for how this could be delivered through videos, through pictures, through descriptions or some other way. And then in column 4, we ask you to consider really what are the best ways of delivering this information that is going to make it most sort of practical and acceptable for yourself or for other patients in the future. In column 5, we ask you to think about any drawbacks to sort of delivering each option, and if there are certain people that might struggle to use this new function. For instance, different languages will be a barrier, but hopefully we can make this available in a range of languages. But there may be other people that might struggle to use these kinds of resources for other reasons. So, you'll also be having a little think about that as well. So for each A4 page in document C, we want you to have a little think about each option. And for the columns in the questions in column 4 and 5, and we want you just to make some notes under the questions. Or if you've got any extra suggestions, you can sort of note them under sort of column 2 and 3 or in the note section at the end. Now, you don't need to write something in every box, and there may be some that you think don't really apply to you or you're unsure about, and that's fine. We're just suggesting spending 5 to 10 minutes on each A4 page, or 30 to 60 minutes in total. You don't need to send us your comments, just have them with you during the workshop, and that's really just going to help guide the discussion. And as you're looking through and looking at the different options in the worksheet and on the day, it's worth thinking about how this new rehabilitation method might be tested in the NHS. So for the NHS to recommend and fund a new treatment, it really needs to do one of two things. It either needs to improve outcomes and recovery by a certain measure, but that's actually really difficult to do because almost none of the studies in the last 10 years have actually been able to demonstrate a true improvement. And so the other option is that it needs to show that the same outcome, but provide a cost saving or be preferable to patients. So all that is to say that we may not be able to offer this new rehabilitation package on top of current care, but we may need to modify and provide a separate pathway for delivering care. And this is just an example of how that might work. For instance, so a patient might come in for their ankle fracture surgery, and while they're waiting on the ward, either before or after their surgery, they could be approached by a research nurse that will say, we're doing this study, and if they want to take part, they'll either be randomly allocated to the new pathway, which might be an app or a website login, or they'll be allocated to the usual care pathway. In both cases, they'll go home. The sort of app group will be able to access information and talk to people on the app as they need. But both groups would then come back at 2 weeks to have their wound check, have their x-rays, and in the app group, if they wanted to, they could be discharged at that 2-week point, or they could come back at 6 weeks as well. But after that, they could probably be discharged, but they would have access to a physiotherapy from 9 to 5, Monday to Friday, anytime within the first year post-operatively, but they wouldn't routinely be referred to a face-to-face physiotherapist or to see a surgeon again. In the normal group, it would just continue what is as normal, and it differs around the UK as to whether people get referred to physiotherapy or whether they come and see different surgeons again, but that would just be as is normal. And then after that, in both groups, they would come and they would answer questions on their phone or email, as many of you will be doing for the WAX trial. So there we are. As we're going through the day, think not just oh yes, this might be an extra little feature to have, but instead, it might be replacing seeing a face-to-face surgeon or physiotherapist. So think carefully about what might need to be included, if that were the case. And so in the previous scenario, I used the example of an app or a website, but you may decide that that's not the best option. And so the purpose of this workshop is to decide what information support is needed, but also in what form. And so there are 3 just suggestions that we've come up with, and there may be others you think of, but the first might be an app or a website login where you can have personalized information. It could be a booklet, similar to the WAX booklet that many of you will have received, or it could be just some emails with a series of links to various videos and other resources. Now, as you'll see, these different options, they allow different types of information to be provided and support, and different levels of care and support. And so today we're trying to decide what option is best. So for instance, just because an app can offer more services, there's no point creating one if no one is going to want to use it. So it's about thinking, what is the best form, and particularly in the context of not having to come back and see another healthcare professional over and over. So that's it for now. This is the reminder of what would be good for you to complete before you come and see us at the workshop. So tick, you've watched the presentation, well done. And now sort of read the other documents that I've sent you in the pack. And if you can make some comments and complete worksheet C. Try and test out Zoom, make sure you've got an up-to-date version. And if you need to have a practice, just send me an email and we can have a practice beforehand. And then just find somewhere suitable where you can join the workshop and bring your worksheets, which can be online or bring your paper copies along. And yeah, any questions, feel free to drop me an email, and I look forward to seeing you all on December the 13th. Thank you.